In this video, we will be discussing the fourth component of MIPS, known as the improvement activities. As was discussed in a previous video, the improvement activities component is a new requirement based on a list of 93 potential actions listed in the final rule. Each activity is worth either 10 or 20 points. To receive full credit, most surgeons will need to accrue a total of 40 points. Surgeons in some rural and small practices will only need to accrue a total of 20 points. For 2017, the reporting mechanism for the improvement activities component is simply attestation. As depicted in this schematic, the improvement activities will comprise the smallest percentage of all the various components of an individual provider's final score at 15%. Each of the activities in the final rule has been deemed either high value, worth 20 points, or medium value, worth 10 points. Again, for most surgeons, a total of 40 points is required to obtain full credit. This translates into at least 2, but no more than 4 activities. Some surgeons in rural and small practices will only be required to accrue 20 points. It is noteworthy that as a result of regulatory advocacy from the ACS and other physician groups, that the requirement in the final rule represents a full 50% reduction of what was originally proposed by CMS. For 2017, the reporting for the improvement activities component will be by simple attestation. Specific mechanisms approved by CMS for reporting one's attestation to satisfy the requirement include the use of traditional registries or qualified clinical data registries. Alternatively, CMS plans to make available a portal on its website where surgeons will be able to attest to their having satisfied their requirement. In reviewing the list of 93 activities, examples of high-value 20-point activities that could potentially be applicable for surgeons include use of a qualified clinical data registry to generate regular performance feedback, consultation of a prescription drug monitoring program prior to the issuance of a Schedule II opioid prescription lasting for longer than 3 days, seeing new and follow-up Medicaid patients in a timely manner to include those individuals duly eligible for both Medicaid and Medicare. Examples of medium-value 10-point activities that could potentially be applicable to surgeons include participation in a qualified clinical data registry or other registry sponsored by a government agency or private entity, such as hospitals or a medical or surgical society, provision of specialist reports back to referring providers in order to close the referral loop, bilateral exchange of necessary patient information relevant to patient care that could include participation in a health information exchange or the use of structured referral notes. Other medium-value 10-point activities that surgeons might choose include participation in Maintenance of Certification Part 4, annual registration with the Prescription Drug Monitoring Program of the state where one practices, use of evidence-based decision aids to support shared decision-making, use of tools that assist specialty practice in tracking specific measures, including the ACS's Surgical Risk Calculator. Though the improvement activities component represents a new requirement, based on the activities available to surgeons and because the requirement specified for reporting is simple attestation, we believe that all surgeons should be able to fulfill the requirement for the improvement activities component with minimal effort and achieve the full 15% credit toward their final score in 2017.